Okay, welcome to day 5 of Kidney Week, and I'm sorry we had to change up the time this morning because Hugh and I have an appointment with a lawyer a half hour away from here at 11 o'clock, so I couldn't figure out how to be on Facebook and be in the car and be on Instagram, and it just wasn't all going to work, so we had to back it up by half an hour. So for people who tune in at 10:30 and you get to see a rerun, I apologize, but we just had way too many things on our plate for today. Gwen's getting ready to go out of town to get up to New York for the Healthy Dog Expo. Sorry I won't be there, but I'm leaving with Hugh on Tuesday to drive to Florida for the Global Pet Expo. So just lots. So Kelly on Instagram, offer a natural solution for fleas. There's tons of natural solutions on my website, drjudymorgan.com. I have a blog, Natural Flea and Tick Prevention Revisited, that highlights all of those, so go look there. Okay, so today we're going to talk about feeding our animals with kidney disease, and this becomes a big dividing point for traditional versus holistic veterinarians. And personally, I think that the holistic veterinarians have a better way of dealing with this, and I have seen that come to fruition with my own dogs that have had kidney disease, and also with a lot of the dogs at Monkey's House. The Monkey's House dogs are just a wonderful testament to the power of food and herbs and supportive care for these animals. So I'm going to kind of compare the difference between traditional and holistic feeding ideas for animals with kidney disease. From a traditional standpoint, when we were talking about SDMA, I said that I get very frustrated because a lot of times a traditional veterinarian will see an SDMA that is 1 point above normal, instantly declare that the animal has kidney disease, and insists that the animal be immediately placed on a restricted prescription diet. And I think that is absolutely the wrong way to go for these animals. The diets are way too restricted for the early stages of disease, and dry kibble of any sort is absolutely contraindicated for animals with kidney disease, because it really is about moisture in, moisture out, flushing, getting the bloodstream filtered and cleaned, and so we need to have a high moisture diet in order to do that. Interestingly, well, ever since I graduated vet school, so we're talking almost 40 years ago, 38 years ago, we veterinarians have always talked about, well, when you have kidney disease, we've got this high BUN. Hello from the Netherlands. You've got this high BUN, you've got all these nitrogen waste products from protein breakdown that are in the bloodstream and causing all these symptoms and side effects. So we immediately want to pull back on the protein levels for these animals. And that has really stayed in place for way too long, way too long. And what we have seen over the years, and I used to see this so much in practice before I became a holistic practitioner, the animals, once they started having kidney problems and we would put them on these really restrictive diets, they would just sort of fall apart, and we would get muscle wasting and weakness, and just they look terrible. They'd stop grooming and have no energy, and really not a good situation for our pets. The traditional veterinarians have gotten a tiny bit better because the IRIS, the International Renal Interest Society, did back off on that a little bit. Yeah, Dr. Nick Thompson, he's amazing. And they are now saying, well, maybe we shouldn't restrict the protein in stage 1. Probably should start being restrictive in stage 2, and definitely in stage 3 and 4. Well, what I have found is that my raw-fed dogs and raw-fed patients who are on fairly high protein diets do just fine. Without restricting them until we're almost at stage 4, when we're really having problems where that BUN is just, you know, sky high. Stewie, for instance, his BUN is 74 right now. No big deal. I don't need to restrict his protein. I'm not worried about it. Part of his problem is he's got protein losing enteropathy. He's losing protein in his bowel. If I restrict protein from that dog, he's going to die because he needs protein to hold the blood and the fluids in the blood vessels, and to keep what muscle we do have. So I don't want to restrict him. Interestingly, in the research that I was doing for this week, what they really have decided for humans as well as dogs and cats is that it's more about phosphorus, that keeping the phosphorus levels at a certain level and restricting that is actually more important than restricting protein. Unfortunately, I also see people with animals with kidney failure that may be very early, stage 1, stage 2, that get so wrapped up in restricting phosphorus that if they look on the internet and see there's any phosphorus in a particular ingredient in the diet, they instantly shun it, run away, and say, no, I can't use that, I can't use that. And we have found that not to be the case. For instance, egg whites, low phosphorus, no problem. Egg yolks, high phosphorus. Everybody runs away from that. Egg yolks are blood tonics. They have fat-soluble vitamins A, D, E, and K. They are very important for our animals with kidney disease. Feed the whole egg. We back off on the protein when we're starting to either get too much protein in the urine, spilling, or our BUN is 150, 200. We just can't get it down. So we want to use probiotics and other things to keep that BUN down. At some point, we're going to have to restrict that protein a little bit. I still don't think that we should restrict it down to the levels of some of these prescription diets that are getting it down to 6 and 8%. That is not compatible with a high quality life. So we don't want to do that, particularly for our cats. Our cats are carnivores. Now, we've got 3 places. Oh, the other thing that is commonly recommended to restrict is sodium because of hypertension. Sodium plays a very, very minor role in hypertension in our animals. The whole sodium thing comes from human medicine and human dietary beliefs. We eat a lot of processed food that's very high in sodium. A lot of salt is used as a preservative. Pet foods do not have a lot of sodium in them. It's not something that is in a high amount in the pet food. So it's going to be very rare for them to be enough. If the estimate is 16 to 17, do you need to remove bone in the diet? No. Sodium, the only time that really is going to come into play is if you're making your own food. You don't want to oversalt it for the pets, but they do need sodium for life. It has a lot of functions, in cellular functions, electrical transmissions on the nerves. So we don't want them to have a 0 sodium diet. We shouldn't be going there. And I see this same thing occurring with dogs and cats with heart disease, and instantly we get the restrict sodium from their diet, and so people go crazy trying to find a diet that doesn't have any salt in it. Salt's fine because in pet food it is in a very small amount. It's not like us eating Doritos that are loaded with salt or frozen dinners that are loaded with salt. It's a very different world for our pets. I don't get too concerned about sodium. What I would be very careful with, and I don't recommend feeding them anyway, are the processed kind of pressed the soft chewy treats that are like in the grocery store, like sausages and those kinds of things. We shouldn't feed those anyway, but those may have a lot of sugar, or hey puppy, I got no help today. Those kinds of things may have a lot of salt or sugar used as preservatives, and so that would be an issue. I don't recommend those kinds of treats anyway. So we've got 3 places we can get our calories for these guys. We can get them from protein, we can get them from fat, and we can get them from carbohydrates. We know that, and remember, a lot of these animals may have comorbidities. They may have pancreatitis. They may have diabetes. They may have heart disease. We know that we're going to have to restrict protein late in the stage. That leaves us two other places to get our calories from: fat and carbohydrates. Carbohydrates, simple carbs that break down to sugars, are not healthy. They're pro-inflammatory. We're trying to keep inflammation down for these guys. We also have to worry about phosphorus content in different grains, and there are different levels, and you can look them up very easily online, because phosphorus restriction for humans with kidney disease is also recommended. So it's really easy to find lists of phosphorus. I found a list the other day that gave 2,000 different foods. Unfortunately, a lot of them were processed foods for human. Forrest is always in trouble. So phosphorus restriction in stage 1, we want to have their phosphorus try to keep it 4.6 or less, which is pretty normal and pretty easy to do. By the time we get to stage 3, we're going to try to keep that phosphorus less than 5. And this is why it's important to have the lab work run and see where you are. Probably by stage 3, you're going to have to start adding in those phosphorus binders to keep that phosphorus level down where we want it to be and decrease damage. So prior to that, you don't have to be too crazy about it. As far as our grains, if we do end up getting to the point where it's like, oh, geez, I might have to back off a little bit on the protein. I've got an animal that doesn't handle fats that well. And fats are great because they have twice as many calories as carbs and protein. Then if we have to add in some carbs, the one that's lowest in phosphorus is going to be millet. And that's why the recipes that we have on the handout do include millet, because that is the lowest phosphorus. If you want to use something like barley, which is from a Chinese medicine standpoint is great for kidney failure because it's cooling and draining and it's a blood tonic, soak it first overnight and that will leach out a lot of that, and then you can cook it and it'll be much better. As far as the pancreatitis thing, remember I talked about don't base it just on amylase, because amylase is going to be high in animals whose kidneys are not filtering well. That's just the way it is. It doesn't mean they have pancreatitis. It just means their kidneys are not filtering the amylase. So do not use that as your testing for pancreatitis. Look at things like CPLI, look at imaging to see, and symptoms. Is the animal symptomatic? And that can be problematic as well. If we've got vomiting and diarrhea, is it from the kidney disease or is it from pancreatitis? So I don't shy away from the fats. I love the fats, but what I really like are raw fats, because raw fats are not oxidized, and raw fats do not cause pancreatitis. It's the cooked fats that are oxidized that cause pancreatitis problems. The other thing that causes pancreatitis problems is synthetic vitamins and minerals. That's going to be more likely to cause inflammatory reactions. For people who don't want to make their own diets, Dr. Harvey's Canine Health, I believe, is their lowest in phosphorus. So that's a good one to look at if you want something simple where you can add your own meats. As far as meats, the lowest phosphorus is going to be in tripe. And I know it stinks to high heaven. I did have one client, I made a diet for her. The dog was in fairly advanced kidney disease, big dog. And that pet owner, God bless her, she cooked a tripe and kidney diet for that dog for a year. But the dog lived a high quality life for a year. And she didn't want to, she was a little nervous about feeding raw, or the dog didn't like raw, I can't remember. But she cooked tripe and kidney in her crock pot outside on her deck for a whole year for that dog. And the dog did great with it, never really lost weight, maintained muscle mass, and it worked really, really well for that dog. And I know that Michelle at Monkey's House, I don't know if she's on, I haven't been watching, she uses a lot of tripe for the dogs with kidney disease. She makes something called tripe gelatin. The recipe is in the Yin and Yang book. So that can be very helpful to get these guys eating. If we get to stage 4 with these guys, or when we get to stage 4, we want to keep the phosphorus less than 6. So you'll notice it's creeping up because it's harder to keep it down. And with the phosphate binders, you may need to give them 3 or 4 times a day. It's not a once a day deal. But if they're not eating well on their own, they won't eat it in the bowl with the food. With the Phosphine, you can mix that in a syringe. It's a powder with some water and get it in that way. Or the epichitin that we talked about, I believe is a capsule. Not sure, because I've never used that. But it is more important that we're monitoring that phosphorus. So from my standpoint, protein is not as critical as the phosphorus is, and I don't even get crazy about the phosphorus until we're in the later stages. You know, I'm watching what it's doing, and I want to, you know, stay as much as possible in that normal range, and use the phosphate binders, your sub-Q fluids appropriately. So if you haven't downloaded it, Gwen had posted it a couple of times, and she probably has posted it again today. I haven't been paying attention to the comments. But we do have a download that you can get on the website that's basically an outline of what we've talked about this week, but included at the bottom of it, there's links for recipes. There's 2 recipes for cats, 2 recipes for dogs, and there are recipes in the Yin and Yang Nutrition for Dogs book. Tonight at 8 p.m., toddler willing, for supporters, we're going to do tcvm, kidney disease. We'll talk about diet from a tcvm standpoint and the symptoms to look at. It'll mirror a little bit what is in the Yin and Yang book, but it'll help clarify for you which direction your pet is going, whether they're too cold or too hot, what foods we can incorporate. Is it okay to start sub-Q fluids when a cat is showing signs of kidney deficiencies? Yes, I would get the lab work done and see where the cat is, and also do a workup to make sure that the heart is going to be okay with the fluids. So, okay, there you go. Gwen's doing her thing, loading our kidney PDFs. Yeah, you can order tripe online and get it shipped. Is one of the easiest things. Unfortunately, the canned tripes that are out there, a lot of them have carrageenan in them, and I just do not recommend carrageenan. Can you add cooked kidney with their homemade food? Yeah, absolutely, absolutely. That can be a little hard to source too, but I know you can get it from Hair Today. Anybody know how Answer's products have changed since change in management? I'm going to be a little careful how I answer that, or maybe I'll avoid it. Just started doing boneless blend raw and introduced a sea coral supplement. There you go. Powder, but nice. There you go. So yeah, you can get frozen tripe from Hair Today. If you're on the East Coast, I think Raw Feeding Miami probably has it. And, oh shoot, there's one out of My Pet Carnivore. I think they're out of Texas. So there's different places around the country where you can get it. OC Raw, maybe. So, okay. Everybody have a wonderful day, a wonderful weekend. Man, we got a lot to do today. So, everybody enjoy. Supporters, see you tonight.